morning and welcome to the University at Albany Center for Public Health Preparedness Grand Round Series. I'm Chris Smith and I'll be your moderator today. Before we start, we would like to ask you to please fill out your evaluations online. Continuing education credits are available after completing the post-test, and your feedback is always important to the development of our future programs. We encourage you to participate today, and we will take your calls later in the hour. The toll-free number is 800-452-0662. You may also send your written questions at any time by fax to 518-426-0696 or by email to the address you see on your screen. Here to speak with us today on point of dispensing model comparisons from Erie County is Tracy Chalmers, the Regional Coordinator of the Office of Public Health Emergency Preparedness in Erie County, New York. Tracy, thanks so much for joining us today.
Thanks, Chris. It's great to be here.
Good. I wanted to talk about the POD that took place last year in Erie County. Of course, our viewers no doubt know this, but POD stands for Points of Dispensing. Correct. In this particular instance. That POD gives a really wonderful example of community involvement in a very short amount of time. A lot had to be done and happened in a hurry. Can you give us an overview of the situation?
Sure. We had learned on a Friday afternoon about a potential hepatitis A exposure, actually it was an actual exposure, in a produce handler in one of our local grocery stores in Buffalo. So very quickly, the Erie County Department of Health and the State Health Department conference called with the Centers for Disease Control and determined that they would go ahead and set up a point of dispensing.
Okay. The threat of hepatitis A, is that serious enough to set up a POD, obviously, but why so?
Well, the concern that we had here was that it was a produce worker in a very large grocery store, so the exposure that could have transmitted to other persons was unknown. So there could have been a very high risk of exposure and secondary disease outbreak in this case. So we decided, going on what the state and the Centers for Disease Control recommended, to go ahead in this case with the POD.
To learn more about how Hep A became a threat in the community, let's hear now from Erie County's Health Commissioner, Dr. Anthony Billetier. Problem with that video, but we'll get through it. Who needed to be treated at this POD? What was done about the produce at the grocery store? There's really a laundry list of questions I want to ask, but let's start there.
Okay. Well, first of all, they decided that anyone that had purchased produce during the period of time that the worker was infectious and was working, which was about a span of 2 weeks, was eligible for post-exposure prophylactic treatment. And they basically determined about a starting number of about 64,000 households, which we narrowed down to about 13,000 heads of households for that case. So Wegmans at the time sent out a telephone alert to all of their consumers that had purchased produce during the time frame we identified, and they alerted them to the situation and advised them to seek further information and to attend the point of dispensing.
And I want to get some more information on that
Sure.
in just a bit. I understand that our videotape is ready, so
Great.
Let's hear now from Dr. Billetier.
I'm Dr. Anthony Billetier, the Commissioner of Health in Erie County. My role is to oversee a department that includes various aspects. One of our roles is to prevent the spread of infectious diseases in Erie County. Midday on Friday, we received a report from one of our local supermarket chains that one of their workers had been diagnosed with hepatitis A. The first question that we really had to ask ourselves was, is this something of significance? In other words, could this infected worker have caused others to become infected or expose them to an infection? And so really that decision needed to be based upon science, or at least as much science as existed. We then needed to decide what action are we going to take and when are we going to take it. So we decided to open the POD on the next day, which is a Saturday. We realized, though, that we couldn't get it going first thing in the morning. We needed the morning to prepare. And so we decided to open the POD about midday. Because it was a weekend, we had significant challenges, including getting staff available and alerting our volunteer participants and many of the other agencies that had to be involved. We treated that as a push POD. And the difference being, pull pods are where you open up a building and you have people come to you and then you give them prophylaxis, whether it be pills or shots. Push pods are where we push vaccine or pills out into the community, and then they're distributed through that mechanism. The supermarket chain, though, had their employees who, not surprisingly, also buy produce from their same store, And so there was a need to also vaccinate their employees. And we decided that rather than having their employees come and further make our challenge and our pull pod greater, that we would do a push pod in the supermarket. You can never foresee every barrier. And so some of the barriers we had been able to overcome initially, and then others we had to think on the fly of how to deal with them. The initial event actually became even more complicated after we learned that the supermarket donated produce to various food pantries. And it wasn't even a direct connection where we could say that they donated to one given food pantry. They actually donated to a service that collected that and then delivered to various food pantries depending on the need in the community. And so that really led to the need to develop some sort of special needs kind of pod. It's important to make sure that we have buy-in from the leadership, and we need to keep them apprised of what we're doing. I don't think the county executive viewed me and our department as new to this, and so I think that helped assure him that we did understand the issues and we were approaching it from a scientific and sound standpoint. We had some glitches, especially early on, where people had to wait a fairly lengthy amount of time, perhaps 3 hours for a shot. Now we're able to reduce that over time by retooling the clinic in real time as we continue to gain experience. But people actually, despite waiting those hours, praised us and thanked us. And so I think the spirit of cooperation and appreciation in our community really was remarkable.
You know, that overview just sets out an enormous set of challenges.
It does.
Dr. Billiter's told us a lot about the situation, but I think it would be helpful to drill down to some specifics. So, Tracy, maybe we could start with the extent of exposure. There's no way of knowing if there was a single person dealing with the produce that was purchased, or if the entire family might have consumed the purchase, or what happened. So, how did you try to determine the extent of exposure, and what were some of the limitations you might have faced?
Well, based on the information we had from Wegmans, they determined that they had 64,000 produce transactions. Again, we have no way of knowing how many people that equated to. What they were able to determine was to fine-tune that number down to 13,000 households. So those were the 13,000 households that they contacted and notified of the potential exposure. However, we had no way of knowing, as Dr. Billiter mentioned, whether or not one person in the family consumed produce, or if they had a party and served it to several other guests as well. So that was an unknown that challenged us throughout the duration of the event.
Well, obviously the partnership with Wegmans was a real important piece of community involvement, but what other community involvement took place in this endeavor?
Well, we had community partnerships, certainly with Wegmans. They were a critical player for us. We utilized all of the county departments within Erie County. We also reached out to the town of Amherst, and we had excellent participation from them. The site we chose for our point of dispensing was located in the town of Amherst. We also had great partnerships and interaction with Erie County Community College, which was the actual site chosen.
Talk to me about how you got the message to the community. I know Wegmans helped. I know you did a lot of fine risk communication, but take us through those steps.
Well, initially Dr. Billiter did a conference Friday afternoon, and that was the initial notification to the community. We also had information directing people with questions to visit both our website, the State Health Department's website, and Wegmans' website. We made sure that we had consistent risk communication information posted on all of those sources. Again, we talked already about Wegmans doing the contact to all of their customers as well. And then we really relied on the media, on television media and radio media, to push the word out to the community.
The last slide we saw had a bullet called expanded operations. What did you mean by that?
Expanded operations, as we got into Sunday afternoon and Sunday evening, we quickly realized that the numbers of people kept coming and the lines were very, very long. And we determined at that point that we thought it was necessary to continue the pod into Monday. So at that time we utilized the media really to convey that message to the public that in fact we would be expanding our operations into the next day, and then we went ahead and updated all the information on the websites as well.
This has already been touched on a bit, but I think it's important to elaborate. When did you decide to have the pod and why? And what about the location? Coming up with a location on such short notice must have been a challenge.
It really wasn't a challenge for the location in this event. We have a number of points of dispensing sites that we've already determined in Erie County as per our plan, And the site we chose, we've actually done walkthroughs before, we've done security assessments, the site met all of the criteria that we thought we needed for this event. And it was a county facility, so it was available to us on very short notice and on the weekend. It also was located in very close proximity to the grocery store in which the event occurred, so we thought it would be very convenient for most people who shop hopefully close to home or close to where they work. So we utilized that location. As Dr. Billetier mentioned, we didn't think on a Friday evening at around 9 p.m. that we could have everything up and running first thing in the morning. So we wanted to give ourselves time to set everything up and the public time to make arrangements to show up at the pod. So we went for a 4 o'clock start time.
Set yourself up for success.
We did.
I imagine in Erie County, although there's mass transit, most of the people would be coming to the pod by cars. Was there accessible parking?
There was quite a bit of parking. That's one of the criteria that we look for when we select a point of dispensing, that it has adequate parking for large volumes of people.
Mm-hmm. Wanted to talk about the communication. You talked about risk communication, and obviously that's paramount to success of this type of endeavor. How did you cooperate with the community members to get the word out, and how was risk communication conducted specifically?
We had several conference calls with all of the partners involved, so the local health department, state health department, Wegmans, of course, was a participant in all of this. And we made sure that the information that we posted to all the websites and all the information that was going out was consistent. And we also utilized our call center. So initially we set up a call center with our local 211. When that became overwhelmed, the state health department actually was able to procure for us a much larger call center that could handle the larger volume of calls that were coming in.
Did you coordinate the scripts in your local call center and the state call center?
Yes, we did.
Oh, I think that's really important, so everybody's getting the same message. So you found a location for the pod. You're ready to reach out to the community. How did the operations get started, and what kind of supplies did you need to have on hand?
Well, we started Friday evening with initial contact of staff and determining what supplies were necessary. So we were pulling supplies in from multiple locations within the county to be delivered to that location. So we made some accidental notifications of critical people Friday evening, and they started very early Friday morning moving supplies to the location for us. Simultaneously, while information was going out to the public and we were getting everything up and running, we were contacting staff and volunteers to alert them to the situation and see if they were available to come in and work.
I seem to recall that buses played a part in your response here. How were they utilized?
We utilized buses actually to stage the clients when the lines became so long that at points they were actually lined up outside. And it was very, very cold for this particular week in February, even cold for what we think of in Buffalo. So very frigid temperatures, not safe for people to be outdoors for any extended period of time. So we staged people on the buses, and we actually utilized the buses to transport them from one location of the parking lot several yards up to the next location, so they would go in the correct door that we wanted them to enter in. At one point, we even started doing patient education on the buses to sort of move the pod flow along a little quicker.
Were the patients more patient when they were able to get out of the cold?
They certainly were. I think we tried to do everything we could to make sure that people were comfortable. They understood that it was going to be a lengthy wait at some times, but again, they were very agreeable for the most part and very pleased with what was being done to help them. So we had chairs set up. We encouraged people to sit down if they were going to be waiting for a long period of time. We had water being circulated. We had information, activity sheets for children. So we really did everything we could to make it as enjoyable for them as possible in the circumstances.
Almost a Disney type of
Almost.
setup for public health. In other words, if people know what to expect, then they're not quite as upset than if they just have to wait with no knowledge
Right.
of what's going to be forthcoming. So you're in the building. What kind of spatial aspects did you have to consider to have a flow that was workable?
Well, the building, we actually ran into some challenges with the space available to us. For the weekend, things seemed to move pretty smoothly, but once we went into Monday operations, and then Tuesday and Wednesday, school was actually open, so we had to retool our pod flow several times to make sure that we were accommodating the staff and students of the college campus that we were on, and also our clients as well, determining what the volume was and moving lines accordingly. But pretty much we utilized classroom space. We wove people in and out of lines and hallways. We utilized the cafeteria and another large student area for our vaccination centers.
So how did you do that with the students trying to resume their classes and you having this huge pod? I mean, how did you make that work?
We ran into some difficulty actually with that. That was one of our challenges that we tried really hard to overcome. We Oftentimes there'd be students walking through our pod operations, and that was very difficult for staff to kind of determine, were they cutting in line or were they supposed to be there on their way to a class. We also were taking up space of the colleges, their learning labs, their kitchens and their food centers for their Culinary Institute program. We were in their space. We had clients that were sort of inconvenienced who are attending the dental clinic, finding difficulty parking, so we arranged for a shuttle service to transport clients of the college and also staff and faculty and students to their classroom locations if they had difficulty parking.
Did any particular station stand out as very much of a bottleneck?
We thought the education station ended up being a bottleneck. There was a lot of information we were handing out, and it was very different from information we've given people in the past. So this wasn't just a routine flu vaccination pod that the public is used to doing. So we had information on hepatitis A, what it is, what the risks were, and then we also had information on hepatitis A vaccine and the immune globulin fact sheets that people were asked to read before they went into the education station. So when they came in there, they were very well versed in the information we had given them, and they had many questions.
What education level were these fact sheets written at?
I'm not sure. They're the typical vaccine information sheets that we utilize from the State Health Department. So the difference in them, though, the immune globulin fact sheet was worded a little bit differently than the hepatitis A vaccine, and I think when people have a lot of time to digest information, they find every little detail that's different and bring it up as a question.
Obviously consistency of information, but in that particular instance, immune globulin was better for some individuals and the vaccine was indicated for others. So having to make that point, I'm sure took a little time as well. Can you talk a bit about the management of medical supplies and Go kits as pertains to your pod?
Sure. We have in Erie County several what we call pod Go kits, which are large storage containers filled with all sorts of supplies and equipment that we might need in a point of dispensing. And actually the picture up on the screen now is of the state's pod Go kits. Ours are very similar. Our packaging looks a little bit different. And they're packed with anything that you might need for a point of dispensing. So one might contain clipboards and pens and pencils and scotch tape, where another container might contain safety vests or flashlights or incident command forms. So it's everything you really need to get up and running for a point of dispensing, except for the vaccine and the actual needles or syringes that you might utilize.
I think I may have heard them referred to as pod in a box from one time, and I wasn't realizing how large the boxes were.
Right.
So yeah. Were there any unknown factors that you had to adapt to? For instance, did you get a lot more people than you expected to respond?
We really were questioning whether or not anybody would come to this. We didn't know if the community felt that the risk of hepatitis A warranted, going to a point of dispensing and standing in line. And we were very surprised. We ended up vaccinating or prophylacticing over 10,000 people over 5 days. So the numbers were much higher than we anticipated. And the numbers varied throughout the day. Like there'd be rushes of people where the lines would be very long. Other times of day there'd be no one in line and people would move through very quickly. So we were always uncertain of how many people would come and how long would they continue to come. So we ended up expanding from a 2-day operation up to 5 days.
How did you estimate how much vaccine to order? It's almost sort of back of the envelope as people are coming through the door.
We really didn't have a good way to estimate, so it wasn't clear whether people would be coming would require vaccination with Hep A vaccine or immune globulin. So a couple of times we actually ran out of immune globulin and we had to procure more in a very short time frame. So that was very difficult. We ended up having enough vaccine on site from what we got from the State Health Department's immunization program, but the IG was certainly an issue for us.
So all said and done, how would you characterize the results of your pod, and how did the response of the county differ from the response of the state, or were they very similar?
We had very different roles, I think. I mean, certainly we were both involved in risk communication and public information. The State Health Department, out of the Buffalo and Rochester regional offices, did send us several hundred staff throughout the duration of the event to help us staff this clinic. So they were on site with us. We also had critical personnel from the Strategic National Stockpile Program on site with us for the duration. We had State Health Department staff involved with us in Incident Command as well. So it was a very good partnership and very good working environment, but I think the response overall, it was a local response supported by the State Health Department.
Did your relationship with community members, your businesses, corporate groups, did any of those change after the pod and this incident?
Certainly Wegmans is a prominent business in our community, but I think this event really highlighted the ability that a corporation has or a private business has to assist in an event like this, and they were really a terrific partner, and we utilized them several times for things such as going to obtain IG for us with their private jet, to bringing in bottled water to hand out to our participants. So they were a terrific partner for us throughout this event. We also relied very heavily on the town of Amherst. Their emergency services coordination unit was on site with us, working with us in Unified Command, and they were a terrific partner as well, a partner that we continued to work with for the next pod that we did.
This seems to be a very successful endeavor. Obviously not one that you would have wished upon yourself, right. But even though you had to change some things on the fly, it seemed to work out pretty well. What were lessons learned?
We learned that even though most of our staff have gone through incident command training, that we really need to push a refresher course to them. We also had some personnel needs. Certainly contacting our staff after hours proved to be very difficult for us. We also had an issue of integration of staff. We had staff coming in from the State Health Department, as I mentioned. We also were very fortunate to have our partner counties from the Western New York Public Health Alliance, which are the 8 counties of Western New York, send staff to us to assist as well. So we had staff coming in, we had volunteers coming in. Trying to integrate all those different agencies together under one command structure was difficult for us at times.
So Tracy, from what you said, it sounds like you determined a need for additional incident command system training and perhaps call down alert training.
Correct.
Anything else that was identified in terms of training needs?
Well, another need that's not specifically a training need was the ability to prophylax a large number of people in a very short period of time, which Dr. Billatier mentioned. It took us 5 days to do 10,000 people, so if we had to do a larger number in a shorter period of time, we really felt that the model that we were using, the pull model, was not very effective for pushing large volumes of people through. So we really wanted to look at something a little more efficient for us to process large volumes of patients.
And we're going to talk about a different model in just a few moments, but for now, can we talk about the staff who had to work really on a last-minute notice over the weekend and then for 5 days, and how did you keep their morale up and keep them in a position to perform good service?
Well, I think once we came into Monday and staff were reassigned, I mean, we pulled staff from every clinic in the department. It was all hands on deck, and it really needed to be a collaborative effort for us. Certainly, staff were stressed out. It was a very long week, long hours. We had our mental health volunteers on site walking around providing services as needed. We also had our canine therapy team. The handlers came in with their therapy dogs, and the dogs sort of walked through the crowd and said hello to people standing in line and our staff and employees as well. So that was helpful for us.
Yeah, and that's all part of your pre-planning, the whole mental health aspect of it. Is this something that you think most counties do in terms of having the therapy dogs available, massage chairs, things like that?
Well, we didn't have massage chairs in this case. It would have been nice, but I think mental health is an important thing to consider in any sort of pre-event planning, and it's something that always comes up as being an issue when it's not addressed proactively. So I think for Erie County, we like to include them as early on as possible, anytime we anticipate there being an issue with long staff hours, staff burnout, and personnel-related needs.
Tracy, you gave us a little hint of the follow-up pod that you did, and right now we're going to hear from Dr. Anthony Billatier to talk about that.
As a follow-up to this, we clearly recognize that if the goal is to be able to vaccinate everybody in our county, which is nearly 1 million people within 5 days, we can't do it using the model we did this hepatitis A pod. It took us 5 days to vaccinate a little over 10,000 people, and so we needed to try a different kind of approach to it. And so we decided to try a different kind of pull pod, and that pull pod was where, again, we advertised to people who got their first hepatitis A shot and might be interested in getting the second of the series, and by that being fully immunized against hepatitis A. And we conducted a drive-thru pod. Essentially that means we collected people at a certain point and did the education and the consent and all of those things, and then had them drive through a big garage where we just vaccinated them as most of them stuck their arm out the window. We actually used the University at Buffalo campus, a building, it was a community building, and did the pre-briefing and the consent and things, and essentially staged the vaccinees. And then we gave them directions and had them drive to the pod, which it was at a different location in a highway garage, the town highway garage. And so part of the challenge there was making sure that people could find their way to the right place. Also making sure that we had good traffic control and also making sure that people were safe. And so, anytime you have a moving car, you could have various issues. And for example, carbon monoxide could be an issue, and especially if it's running vehicles inside of a building, and so we monitored for that. We also needed to make sure that our staff was safe, that nobody would get run over. We made it clear to people that for the most part they were already protected against the outbreak. Giving them a second hepatitis A vaccination really just provided them with protections in the future. But in this scenario, we were fortunate to secure free vaccine from the State Health Department. And so I think people came into that with a different mindset. It was an elective thing, and they chose to actually help us. We told them in some ways we're experimenting with you to see if we can give you a shot as you stick your arm out the window of your car. And again, the community came through. We didn't have anywhere near the amount of people we had in the first pod, but we had enough people that we could at least test the system.
So once again, Tracy, Dr. Billetier's given us a very good overview, but let's talk about some specifics. Sure. Talk about how you determined the need for the second pod and what kind of planning exactly went into determining that there was a need.
We actually based our decision for the second pod on the ability to take a definite number of people that we already had identified as needing a second vaccination, and sort of use them, as Dr. Billetier alluded to, as a test group to push this other model, this drive-through model. So we wanted to look at the after-action report and the lessons learned, certainly from the first pod, and utilize this training event to sort of correct those things and revise our plan as necessary to sort of improve those things that we determined were not very effective the first time around. We also, as Dr. Billetier mentioned, thought this was a great opportunity for people to receive the second dose of the vaccination so they'd have long-lasting protection.
Were there other goals that you had?
Well, we certainly thought that we would expand the partnerships that we had developed the first time around, and we were testing certainly a new model for us. We've never done a drive-through pod in Erie County, so this was the first one.
The first time around, obviously, you really didn't know what to order in terms of vaccine or IG or how many supplies you need, how many clipboards,
right,
paper, pens. This time around, it was more determined. Was that correct?
It was more determined. We had a definite number of people that had received the hepatitis A vaccine the first time. The number was about 5,000. So we started with that group, and really the invitations for attendance at that only went out to those individuals who had received hepatitis A vaccine from us in February. So we knew that the number couldn't be any larger than 5,500.
Well, when you're working with a line of moving cars in a garage setting, I imagine it's quite a bit different from a indoor clinical setting. And what were some of the considerations that had to go into that?
Safety really was the number one issue. We had some non-believers, I think we still do in Erie County, that felt that this was just not a great idea. And having staff around moving vehicles is very dangerous, and it can be very dangerous. So a lot of time went into the planning and the safety plan, making sure that we had traffic trailers on site with traffic cones and variable message signs everywhere. Everyone was in safety vests. It was a very, very carefully planned event for us.
How did you triage the patients at this type of pod?
Well, we had sent them a letter ahead of time saying, we'd like you to consider coming to the second pod. It's going to be a drive-through. They knew that ahead of time. And the side effect for you will be the second vaccination that you need, and also to help us test this plan. So we had great buy-in from the community in this aspect. So in the letter, they were directed, as Dr. Billetier said, to the University of Buffalo Center for Tomorrow, and we staged them there. So they didn't really know where the final administration of the vaccine was going to be. And then once they got there and they were triaged, and we basically determined that they had in fact been vaccinated in February, that they had no side effects or contraindications to vaccination, and that they were feeling well that day. And then they were given some instructions on how to proceed to the vaccination site.
Were there any really unexpected surprises? I'm thinking of people talking on their cell phones when you're trying to give them instructions, or coming with a car full of unhappy children, or maybe pets barking. Any of those things happen?
We had a very few instances of things like that happening. The letter that we wrote, we were very careful to highlight the main issues for them. We told them that they'd be in a vehicle. We asked them to wear short-sleeve shirts. We asked them to, bring all their family members together, that they could be waiting, so to be ready for that, have entertainment or refreshments for the children, to make sure that they use the restroom before leaving the house. We also mentioned to them that we did not want to have any pets. So if there was a pet in the car, then I don't think anyone actually showed up with a pet in the car. But that was certainly a concern. It was one of the safety issues that we thought about.
A couple of other things that occurred to me. I think carbon monoxide has sometimes been an issue in research on drive-through
Right.
pods. Did you take this into account?
We did. We looked at many other models of drive-through pods that had been done, certainly in New York State, and looked at all of their after-action reports and concerns. And carbon monoxide was an issue for us that we felt we needed to address. So what we did is we had a plan in place, and it turned out that the highway garage that we utilized in Amherst had very good preventive mechanisms in place. It was a very well ventilated area. They had recently installed some fans inside that were certainly going to reduce the amount of carbon monoxide in there, because they routinely run 20 to 30 snow plows or trucks in there at any one time. So we had that measure in place, and then we did hourly on-site carbon monoxide monitoring throughout the event. We had environmental health staff there with portable CO monitors measuring that for us throughout the event.
How many of those staff did you need?
We utilized a large number of our environmental health staff. I think we had probably 2 to 3 people at any one time measuring for CO.
Another question that occurs to me, and perhaps it's not relevant, but the issue of patient privacy. If you have more than one person in the automobile, when they're talking about their medical indications or contraindications, others can hear it. Is that a concern in a drive-through pod?
I guess it could be a concern. It wasn't a concern for us. This was a defined population. Most people came as family units, so I think they were all pretty much familiar with each other's medical history. And most of the time it was either a spouse in the front seat or some children in the back seat, that I don't think we were discussing really any medical information that they were concerned about. It certainly didn't come up from any of the clients as an issue for us.
Okay, I guess something to think about,
It
though.
is.
Talk about the staff who participated in the drive-through pod. How were they prepared for the staff? And you mentioned that you had environmental health staff there, obviously clinical staff, but who comprised the staff?
We invited pretty much anyone in the health department who wanted to participate in this event. They were given the opportunity. We had a couple of requirements that we asked people to attend a pre-event training session where we went over the working in a pod model. We also went through specific operational details regarding the drive-through pod. We addressed many of the safety issues and what they would expect when they got there. We also did a refresher for them on the incident command system, on the critical points that we thought needed to be reinforced for this event. So that was the requirement for any staff or volunteers. So we had Erie County Department of Health staff there. We also had our SMART team, our Specialized Medical Assistance Response Team, which is our equivalent in Erie County of a Medical Reserve Corps. And we extended the invitation to our local Community Emergency Response, or CERT teams as well.
Who did you need to partner with in this instance to make the pod work? Did Wegmans take part in this at all?
Actually, Wegmans was another terrific partner for this event. They were involved with us throughout the planning process. We actually utilized the Wegmans staff to sort of test the model. So we invited their staff to come out. Instead of pushing a vaccine to them, as we had done in February, we invited them out Friday evening, and we used them to sort of test the flow through the pod.
Sorry, I didn't mean to
Oh, no.
interrupt. I think I heard you allude to the fact that it was a county-owned facility.
The first time it was a county-owned facility, it was a community college. In this event, it was the town of Amherst Highway Garage. So Amherst, again, was a terrific partner for us. They actually procured the site for us. They made sure that the site was cleaned out for us ahead of time, and they were involved. They were actually represented in Unified Command along with the County Health Department.
Was that what you call the Center for Tomorrow?
The Center for Tomorrow was the University of Buffalo. So again, that's another partner that we partnered with. The emergency coordinator from University of Buffalo was also involved with us throughout the planning process. We also, again, reached out to our Western New York Public Health Alliance counties, and we had participation from them as well.
So it sounds like in terms of communicating to people about this pod, it was more direct, the letters that you sent out.
was.
Did you use media at all, or any indirect communication?
We did have some media coverage of the actual event. We did not utilize the media to advertise the event. We didn't want people who had not received the first dose from us in February showing up at this event. So we did not utilize the media in this case to sort of advertise, but we did utilize them to sort of promote the fact that this is a community preparedness exercise and that we did have good participation from the media at the actual event.
You gave us some insight into how this pod flowed, but can you take us through it step by step?
Sure. People drove into the Center for Tomorrow, and they were triaged with 3 basic questions when they arrived there. They were asked to make sure that they had received the vaccine in February, that they had no side effects from it when they received it and that they were feeling well. And then they were triaged from there. They were given driving instructions. We avoided posting signs on the major roads and highways that we were having people drive through. It was very straightforward. It was a couple of right turns, and then they turned right into the Amherst Highway garage. So as you can see on the slide up on the monitor, they came in one entrance. They were directed there. They were triaged either what we call fast or slow, which we can get to in a minute. And then they were directed actually into the highway garage itself. So once they went into the garage, we queued them up in groups of 4 on the fast side and the slow side, and we asked them to pull all the way forward if possible. And we held them there, and then once the vehicles were safely stopped, the environmental health people that were working advised the nurses that they could approach the vehicle, administer the vaccination. Then the cars as a group were directed out of there and queued up in where they are right now, where they were held for 15 minutes post-vaccination in a waiting area where we asked them to complete a survey, which sort of guaranteed that they'd stay there for 15 minutes. That was another safety concern, that we didn't want people right after vaccination, driving off. And then they were directed out a separate entrance that they came in.
That's a good point. I was going to ask you, how do you ensure that somebody doesn't faint behind the wheel
Right.
of the car? Somebody might be in a hurry to get
Right.
out.
We had directed participants that if they had any medical emergencies, they should beep their horn and turn their flashers on, and we had EMTs staffing that post-vaccination waiting area.
Okay, so you referenced the fast and the slow triage.
Right.
What does that mean?
What we did is we determined based on a couple of different factors. So depending on what the size of the vehicle was, for example, a small sedan with a driver and a passenger in the front seat, we would triage to fast, meaning they could be approached quickly from both sides, vaccinated without any complications, and sent on their way. Other vehicles, an example of a slow vehicle might be a minivan with a mom in front and 3 kids strapped into car seats in the back seat, might be triaged slow. And that meant that they went on the different side of the pod operation, and a little more attention and time was spent with them to make sure that maybe the mom had to get out of the car and stand next to the child while he or she was vaccinated.
Because the child sitting in that middle seat, you really can't get to
Can't get to them.
their bare arms. So when it came to the administration of the vaccine, what steps do the visitors have to go through?
They were directed again from the Amherst, they started at the University of Buffalo, Center for Tomorrow. They were directed to the Amherst Highway Garage. They went through the process there. They were basically given the information sheets to fill out. We didn't want them filling out sheets while they were driving, so they were parked, filled out their sheets, their forms were reviewed. They were sent on their way. They did go through medical screening again if they had questions by physicians, and then they were triaged again. We made sure that they were re-triaged if necessary. They went through, received their vaccination, were sent out into the queue where they waited for 15 minutes, filled out their survey, and then they were directed out the door.
Did anyone show up you hadn't expected, a friend of a friend who heard about it and thought it might be a good idea?
I think we had maybe 2 people that we ended up vaccinating that had not, in fact, received hepatitis A vaccine the first time around. They had received IG. So they weren't new to the pod operation. They were just hadn't received the correct product the first time around for them to be there in September.
So you have the traditional pull pod to start, the clinic setting, and then you have the push pod, the drive-through pod. In the end, what model did the staff prefer?
The staff actually preferred the drive-through model. They thought it was faster for the vaccinees. They thought it had the fewest interruptions in pod flow. It flowed faster and more efficiently, and they found it overall to be better. The only issue with the staff is we had some staff were still concerned about the safety issue.
How about the participants? What did they prefer?
They definitely preferred the drive-through. I mean, they felt it was faster. I mean, compared to February, where many of them might have had to wait up to 3 hours, this was an in-and-out procedure for them. They were comfortable in their vehicles. Kids were entertained in the car. They could have, bottles of water, cups of coffee there. They had their radios on low until we directed them to turn them off. So they were certainly more comfortable in their vehicles. And we also felt that in a public health emergency with an infectious disease, a drive-through is certainly a better way to make sure that people aren't transmitting diseases to one another.
Tell me again what month the push pod, the drive-through was held in?
The drive-through was held in September.
September. So but was weather a factor, though, in whether they were more satisfied with that one, do you think?
I think weather is always a factor, certainly in where we are in the country, but we had directed participants and staff be prepared for all types of weather. So the first day of the pod, it poured. It was pouring. We ended up having to procure rain ponchos, set up temporary shelters for staff to stand under, so it was pouring. The second day, it was hot and sunny, and we had staff that we had to pull in because they didn't have the proper, sun protection on. They didn't have hats or sunglasses or sunscreen on, and we had to pull them in. So the weather is always a factor, but I think for the participants, they were in their climate-controlled vehicle, certainly, where they could adjust the heat or the air conditioning to suit their needs. So they certainly weren't parking their car and walking, in very frigid temperatures.
So it was okay for them to keep their cars running while they waited?
They kept their cars running.
And that's why you had the carbon monoxide detection ability. I guess you'd characterize, no, I'm not going to say I guess, I know that you would characterize both of the Hep A pods as ultimately successful. But do you have any final thoughts on how the two compare? Are Drive-thru, there are plans to implement other Drive-thru pods again, or was this just a test vehicle, if you will?
This was really a test for us. We haven't considered whether or not we would test the drive-thru model again. We have considered some other models that we'd like to test, some other push models where we would bring vaccination or prophylaxis to the community more directly, maybe utilizing the Postal Service or school buses. So things like that we are contemplating. But we'll see. We'll see when flu vaccination season comes up again this fall, which model we'll utilize in Erie County.
Tracy, I've got a couple more questions, but I do want to give our viewers a chance to call in. And so this is to let you know we are ready to take your calls now. The toll-free number is 800-452-0662. Or you may send written questions by fax to 518-426-0696. And actually, I do have a question which comes to us from Texas. Liz Adams wants to know, I think it's the Ector County Health Department in Texas. Throughout this process, and that's the original pod, was the city or county emergency operations center set up and utilized in addition to the health department's emergency operations?
We did utilize an emergency operations center, but we had our incident command post was actually co-located at the pod location. We felt that everything was contained to that location, so the staff that we utilized from other departments in the county, we brought to that location, so everybody was co-located there. We didn't open up the actual emergency operations center. The city of Buffalo, the participation from the city, this event was in a suburb of the city, so they weren't directly involved except when we got into the issue with the food pantries that Dr. Billatier had mentioned. That required some coordination and logistics with the city to make sure that we could bring those people to our location if necessary.
Someone from the Albany County Public Health Department would like to, from the Center for Public Health Preparedness has a question and wanted to know, were there any problems with vehicles breaking down or running out of gas at the drive-thru pod?
That was an issue that we had considered what we would do in that case, and the decision was we would tow them out of the way. It didn't happen. We didn't have to do that, but that is something that we thought about, what happens when a vehicle breaks down and certainly is interrupting the pod flow and becomes a safety issue. So I think anyone considering a drive-thru pod, that's something to think about, making sure you have a plan in place to address that issue if it happens.
Not to jump around, but back to the original pod, and from all you've told me, your corporate partner, Wegmans, just went to the nth degree
They did.
To help you out. And at some point you said they actually provided their private plane.
They did.
Did they suggest that? Did you ask them? Why was it needed?
I'm not sure exactly how it came up. It was something about the IG being located in Tennessee, and if we only had a private jet to fly there and get it, and they're like, oh, we have a jet. So they made arrangements to utilize their private jet to go down actually twice and pick up IG for us.
One of the questions that I had was about the call center, because you got an call center operation going very quickly, and then very quickly it became overwhelmed. Now, am I correct in that the state call center and the Erie County call center were used, they were under the same contract, so was that one of the reasons they were overwhelmed?
I'm not sure exactly if they were under the same contract, but the system that the state was using became overwhelmed, and then they ended up going to a new system, which was based out of Newfoundland, and they actually had the capacity for a much greater volume. So I think that was an on-the-fly sort of learning thing that we came up with, I think that the state might use in the future, so it worked very well for everyone.
Yeah, that important lesson learned. And obviously you said that the scripts were consistent because you didn't want any of the people who needed information calling one place, getting one set of facts and calling another, and even just slightly different facts would have been a problem.
It would have.
How about the media? Did they report correctly, or were there inconsistencies in the information they were giving out?
They were pretty good. We had Dr. Billatier did several press conferences with them, and we had them on site several times doing live coverage of the event. So I felt that they were pretty consistent in their coverage.
Well, I think that's good. One of the points that I seem to recall, and I'm not sure if you're familiar with it, but I saw it in a couple of articles, and then it was changed, and it was who was in fact exposed. And at one point, one of the media outlets reported that if you had even touched the produce and then potentially touched your mouth, that you probably ought to go to get some vaccine. So how do you counter misinformation like that?
I think risk communication is critical, and I think the information that we had up on the website and that Dr. Billatier portrayed to the media was that touching the produce was not enough to cause someone to become ill. You had to have actually consumed the raw produce, so not have cooked it and not have washed it. So I think he was very careful to make that very clear to the public.
And I seem to recall that he actually talked about the science again, but in very clear, understandable terms. Not a lot of obfuscation there. So let's say you had 24 hours to set up a pod. Has to happen in 24 hours. You personally, you're going to recommend the traditional model or the drive-thru?
I'm going to recommend the traditional model based on what I think our staff is most familiar with, most comfortable with. Depending on the location, I think the drive-thru, while it worked very well, there was a lot of lead time in planning for that event. So I think to pull that off in 24 hours with no notice might be a little bit more difficult.
We have a fax question that actually is multi-part. First of all, it talks about the documentation that was needed and the clinical data management system. How was that incorporated? CDMS, everybody's favorite.
Everybody's favorite, the CDMS. We actually had difficulty with the CDMS form early Saturday morning. We had Nicole Natarajan from the state's SNS program on site with us trying to resolve that issue for us. We ended up not being able to utilize the CDMS form in its intended purposes. So we did have a form very similar to that we utilized. We were not able to scan the forms in at the end of the event, so we ended up having to go to manual data entry of all the forms post-event.
And actually, Chris Crane from Monroe County sent these set of questions in. They're very good. He wonders also, did you use transmitters to broadcast info to car radios?
We did not. We had considered that for the drive-thru, but we did not actually do that.
I suppose that's something that could be considered
It could
then,
be.
and in terms of education as well, maybe saving a step. And was this the first time you created an incident action plan?
No, it's not. Every event that we do in the County Health Department, we fall back to the incident command system. So we are certainly not new to incident action plans. I think where we're still struggling is to get them up and running a little bit sooner so that we're not playing that catch-up game into the next operational period. So we had incident action plans for the first Hep A, although a little bit delayed. They were there, they were existent. And then for the second one, we did a much better job of making sure that those incident action plans were published and actually distributed to the people that needed to see them.
Can I go back to the risk communication aspect? Because
Sure.
I'm going to tell a tale out of school. Erie County Department of Health did such a good job with risk communication in this incident that in fact you were awarded the Real-Time Risk Communication Silver Award from the National Public Health Information Coalition this year, which is a major award, and it's not given out easily. So I would like you to brag on what you did and talk about that some more.
Great.
For instance, there's always the thought that if you give the public information, you might panic some members of the public. You needed to inform people who were exposed that they needed to get vaccinated or IG. How did you do this while keeping it low-key enough not to cause panic or undue concern, and yet stimulating people to go and stand in line in the cold for 3 hours? That had to be, kind of a tough sequence to follow.
Yeah, and I think there are a couple of components to consider. I certainly think the message is important, that it's crafted well, that it's easy to understand, and that it hits all the high points. I think also the delivery of the message, and in Erie County, we're very, very fortunate with Dr. Billatier. He's an excellent public speaker, and I think he does a tremendous job of communicating the actual risk to the public and not overwhelming them. I think in his first press conference he mentioned, if you were at a Super Bowl party and there was raw produce there, you might have been exposed as well. So just things like that, really putting things in layman's terms and putting them on levels that the public can understand and appreciate. And I think this was hepatitis A. It's pretty common in the United States. There's not a whole lot of severe morbidity or mortality associated with it. I think if it would have been something more serious like anthrax or pandemic flu or plague or something with a lot more risk involved, I think the public message would have been more difficult to craft to not alarm the public.
But on the other hand, because it's not particularly alarming to some people, you had to get them off their good intentions and out there roll up their sleeves.
Right.
So you had to do that as well. You did a great job with the risk
Thank
communication,
you.
and I really think that you should be proud of it. We have a fax from Alberta Knorr, who is with the Vermont Department of Health. She's a public health specialist in RN, and she'd like you to go over your staffing numbers per pod per day, if you could, or give us your best explanation, and what specifically were the pod hours of operation?
Well, the first pod, the push pod, we started at 4 p.m. and we ran until 10 p.m. I believe, 8 p.m. or 10 p.m. I think it was 10 p.m. on that Saturday evening. And we staffed to the maximum capacity. So we only have about 42 public health nurses in Erie County. So beside what we pulled in from the state health department and our alliance counties and volunteers that were able to vaccinate for us, we determined the numbers of vaccination stations based on a couple of things, what the staffing looked like at the time and what the patient volume was. So many times throughout the event, we switched around numbers. We moved people over to Hepatitis A or pulled them off Hep A and brought them over to the IG side. So I think at any one time we probably had on average, I'd say, 25 to 35 stations set up with a vaccinator and a vaccine assistant at each one for the drive-thru, or for the actual one. For the drive-thru, we had each of those squares that were up on the previous slide. I don't know if we can pull up the slide of the drive-thru model.
Maybe they could try to do that.
Yeah, while they're doing that, at each one of those stations, so each car would pull up in a queue up to 4 cars, and then that vehicle would be approached by a nurse from each side to vaccinate. So as you can see there with all those squares, the ones actually in the center were those were double-sided. So that really is the maximum. It was 2 nurses per station there approaching the vehicle from 2 different sides to facilitate efficient movement through the process.
What type of security did you have to have in case people became disgruntled at waiting, or who wanted IG when they really were indicated for vaccine? Or what kind of security did you have in place?
We had the Erie County Sheriffs on site at the first pod providing security for us, and a couple of a few times we had some concerns about safety and security. We had issues certainly with staff not putting their purses under their desks or things like that, but I think we might have only had one incident where the sheriff was actually paged over for a security issue. But for the most part, people were very orderly and well behaved.
I want to give our viewers a chance to call in. Again, you've been faxing great questions, but we'd really love to actually hear your voice. So let me give you that number again. It's 1-800-452-0662, and we do have time for some more fax questions to 518-426-0696, but don't be shy. Call in some questions if you want. This question talked about weather considerations with a drive-through pod. Do you think it would work with the wonderful New York winters? Now, come on, if you like to ski, they are wonderful.
Well, I don't particularly like to ski, so I think it would depend. It would depend on where you were doing your patient education and your form review. In this case, we were doing those things outdoors, so I think the weather certainly worked for the most part in our favor. I think in the winter, having people have to roll down their windows and have staff stand outside, I think would be the issue. So I think if you could keep everything contained to an inside facility and keep people in their vehicles, it would work. But I certainly would not recommend keeping staff outside in the winter for that.
Yeah, that would be difficult. And even just the conditions to work in, slippery conditions would. The weather consideration occurs to me again because I remember at some point when you were planning whether to extend the pod operations another day, the one day was it was blizzard-like conditions, and I think a decision had to be made very rapidly to extend pod operations. Right. And so was that how difficult was it to make that decision in a hurry?
The weather was quite bad, and that really was a concern that perhaps there were people that needed to come to the pod that had intended to come that day or that evening that were unable to get there because of the inclement weather. So that went into our decision certainly to extend the operations another day. We wanted to make sure we were catching everybody possible and that the weather was not a deterrent for people to receive the treatment that they could have needed.
You provided such a wealth of information, and I'm sure that people are going to have follow-up questions. Is there a way they can contact you with questions?
They can. They can either call me in the office or they can send me an email. My contact information is up on the screen there. So I'm happy to answer any questions that anybody has.
We actually do have someone on the phone.
Oh.
Yay. Can we hear your question, please?
Yes, good morning. I was just wondering if Tracy had any idea of the cost of this, of the pods. I mean, it seems like it might be exorbitant with all the town people and everybody involved. I just wondered if you had any idea.
The costs really are, I think, are a little bit difficult to quantify. The State Health Department has come up with what their costs were for the first one. For us, most of the cost actually was staff time, overtime, and things like that. Supplies were minimal. We had everything pretty much on hand. The state provided the vaccine for us. The IG was an expense that we had to procure for the first pod, obviously not for the second one. Most of the participation that we had from our partners, from our volunteers, certainly from the town of Amherst, those were in-kind or donated services. We reimbursed the town for, paper that we utilized or things that we took out of their facility and utilized. I would say for the first pod, it was quite high. I don't think I could wager a guess. The second one, I'm going to say the staff time alone, with the staff time and other things, probably about $100,000.
We've got another call from Jess Wade in Dallas, and we've got 2 minutes for the question and the answer, so go ahead, Jess.
You mentioned that you, for your drive-thru pod, that you didn't use the media, and I didn't understand how you communicated the fact that you wanted your people to come without pets and to wear short sleeves and so forth. How did you communicate that in advance?
We had all of their information from the first pod, so we actually sent them a letter. We did a direct mailing to all of the participants with those instructions in there and the date and time to report, and then information if they had questions to contact our office.
So bottom line, you learned a lot from this?
We did. We learned quite a bit.
And I want to thank you for sharing your experience so that our viewers can learn as well.
Thank you for having me here.
Well, thank you so much for joining us today. We would like to ask that our viewers fill out their online evaluation. As we said before, your feedback is very helpful in planning future programs, and continuing education credits are available after completing the post-test. This program will be available online within about a week. Please check our website for details. I'm Christine Smith, looking forward to seeing you next time on the University at Albany Center for Public Health Preparedness Grand Round Series.